All right, good afternoon, folks. Happy Friday. My name is Franco Calabrese. I'm a physical therapist at our West Loop location. I'm the clinic director as well as a treating therapist, and I'm going to talk to you folks today a little bit about foot and ankle issues that pop up and the common diagnoses that some of you may have experienced, or those close to you may experienced, and kind of how we navigate that in the clinic, what a treatment strategy might look like, and how to effectively self-manage it at home. A little bit about myself. I've been a physical therapist for about 6 years and have helped hundreds of patients from young athletes to professional athletes to everyday patients, and have seen pretty much every common injury and some more complex injuries that you can think of, and have had some good success with implementing the treatment strategy that we provide at React Physical Therapy, which is called the REVI method, which is a whole body approach to treatment, where through our examination and testing, we will identify what muscle groups may or may not be kind of functioning at their optimal level, and how we can rebalance the body and help to strengthen and restore function and movement in a pain-free fashion, and help you kind of regain your lives back, whether it's activity levels, whether it's getting back to sport, whether it's improving your day-to-day lives. We're here to kind of help you navigate that, and I will touch base back on kind of what we do here at React Physical Therapy. And let me share my screen here. If you folks have any questions while I'm kind of going through my presentation, I created a simple kind of PowerPoint to help kind of navigate that, but a lot of this is more going to be expounding on the slides. And then I'm going to be doing some demonstrations, but if you have any questions, feel free to put them in the chat box, and you can type it, make sure that it's the little drop-down toggle that says all panelists and attendees. This way I can see it and kind of respond to you. All right, so I'm going to share my screen here. Not really sure why this isn't working. I apologize, folks. Oops. Okay, let's try that again. There we go. Okay. We are going to share. Here we go. Here is the slideshow. So this is, for lack of a better, easy way, happy feet and ankles. So today's agenda, let me enlarge this a little bit for everybody. Today's agenda, we're going to cover the most common foot and ankle injuries or issues that we see in the clinic. Some tips and tricks to help distinguish any foot and ankle issues that may arise. Some soft tissue releases for the shin and foot muscles. So that's basically any below the knee. Exercises to help bulletproof your feet and ankles, things that you can do with minimal equipment at home, and how React can be a resource for you, whether you are a current patient, former patient, or just maybe have some more information on whether or not physical therapy might be the right avenue for you. Just a little bit of background, some just simple anatomy. There are 26 bones, 33 joints, and over 100 muscles and ligaments and tendons that comprise the foot and ankle. These bones and muscles allow your foot to give you support and help propel you forward or backwards when you are walking or running or standing. Some of these also contribute to how our body is going to respond, right? When we're standing, when we're running, when we're walking, our feet are the first point of contact with the ground. So if we don't have nice symmetry and balance between our feet, that's going to affect the forces as they run up our shin, our knees, our hips, and why, you know, foot and ankle health is very important for not only function, but also for other joints in our body. There are three main sections of the foot: the rear foot, which is comprised of the heel and ankle bones, the most posterior part of the foot; the middle part of the foot, which is the bones that make up the arch of your foot, so kind of that cross-section area of the foot. If you know, I'll demonstrate here, but I don't want to jump back and forth. So if my hand is kind of mimicking a foot, the hind foot would be the heel here, the middle foot would be across the arch here, and the forefoot, which is the toes and phalanges, is the front part of the foot. The 8 most common foot and ankle injuries that we typically see are ankle sprains. I would say is number 1 for sure. And there are 2 distinguishing kind of ankle sprains that one can experience. The inversion ankle sprain, or the low ankle sprain, would be when your foot kind of rolls inward. So if you're tripping over a curb and you kind of roll your foot inward, that is typically commonly known as a low ankle sprain. A high ankle sprain is a little further up, just above the crease where the ankle kind of bends backwards of that crease joint there. And that is commonly a little bit more forceful, usually with impact or activity or sport dependent. And that's going to affect the joint itself and the ligaments that are a little higher up on the ankle itself. We have plantar fasciitis, which is kind of inner heel arch pain. And the distinguishing factor between plantar fasciitis and maybe some other just heel pain itself is very painful steps first thing in the morning. You know, when you sit up out of bed, when you put your feet down and you try to stand up and you feel that discomfort right away, like very pinpoint, localized, sharp pain that tends to get better with activity, meaning that the pain will dissipate the more you walk and kind of stretch out that area. Achilles tendinopathy is kind of right where the back of the heel, if you were to grab the back of your heel here, I'm going to lower this a little bit, kind of the back part here, that is where we're going to feel that Achilles tendinopathy. And I will zoom out here so you guys can see a little bit once I get done with these. And that is usually with more impactful activities like running, jumping, cutting, you know, basketball players, volleyball players, any high level bounding motions, meaning where we have a lot of impact with our foot. That is usually what is attributed to that. And that's usually accompanied with a lot of calf tightness. A stress fracture, that is a bone injury that commonly happens in the toes of our foot, but can also happen in our shin. And this is again a very localized, painful symptom with repeated jumping and running. It's a little different than kind of the Achilles tendinopathy, not only for the area in which it affects, but also the symptoms. It's a little bit more localized, but it's also a little bit more intense. Bunions are major complaints of the big toe of the foot. That's where the big toe starts to kind of point inward toward the other digits and affects the inside part of that. And usually that is, you know, that could be some, you know, genetics or foot anatomy, but usually with closed toe or more narrow base shoes is when we typically see that. Neuromas is a sensation of numbness and tingling, usually on the bottom part of the front part of the foot, usually under the digits where the pads of our feet are, where we're kind of like pushing off. So if this is the bottom part of your foot, if this is your toe, the neuromas would typically affect this area right in there. Heel spurs, that's just an extra formation that we see at the heel bone, which can or cannot reproduce pain. Sometimes folks that have some x-rays and imaging will experience pain, but I have had patients, and my colleagues have had patients where the presence of the spur itself may or may not produce symptoms. And then The last one that we typically see, again, most commonly with runners or more active lifestyle individuals, is the medial tibial stress syndrome, also known as shin splints, which is an uncomfortable sensation on the inside part of the shin with prolonged walking or activity. So how do we approach this, and how do we kind of manage the pain of patients that come in with this? So the few things that we want to do is kind of a systematic approach to the muscles and joints. First, we want to release. What does that mean? So oftentimes when people are coming in with injuries, the muscles of our body parts might feel really, really tight. What that means is that the compressive forces on the muscles may give that sensation that something's tight and needs to feel stretched. And what we do with releases in the clinic, we use a hands-on technique called an active muscle release. And what that looks like is that we apply pressure application to the tight muscle while we have the patient move that body part through its range of motion. So I'm going to come out of the shared screen action here and kind of demonstrate what I mean by that. So I'm going to back up a little bit, and I'm going to grab a lacrosse ball here. Just give me one moment, please. Okay. Before I get back into demonstrating some releases, we have a question. Are hammer toes a common problem? Yes, they are a common problem. I don't think they're as prevalent, or we have not seen the frequency with which I have seen the other diagnoses that I explained. But yes, hammer toes are a common issue that affect. So if my hand looks like a foot, hammer toes basically means that the toes are no longer going to be in a straightened plane. They're going to kind of curl up on the top part here, which means they're going to be in more a flexed or curled position versus a straightened or extended position. Okay, so I'm gonna take my headphones out here, and I'm gonna demonstrate some of the releases which you can replicate at home. So one of the first releases that we like to do is for the shin muscle here. So I'm gonna hike up my pants here. So the shin muscle is the muscle that goes on the top part here down the foot and helps flex the foot upward toward you. So there's a couple of different ways we can approach this, but the easiest way that I like to do it is with a lacrosse ball or a firm ball. Now, if some of you are wondering if a tennis ball would work, I would say that if your area is very, very hypersensitive, meaning that it's very, very tender to touch, then a tennis ball might be a good thing to start with. But I like to use a lacrosse ball or something that's a little bit firmer so you can apply pressure to it. So what a release will do, I'm going to lower this a little bit so you can see better. What a release will do is, as we're applying it here, we're going to apply pressure downward and against the bone in toward me. And then I'm going to move my foot in the direction in which this muscle controls. So we're going to start, here's my shin bone here. I'm going to go just to the outside of it. I'm going to apply a little bit of force, and then I'm going to move the foot up and down. And then I'm going to slowly move down that shin, down that muscle itself, as I get closer to the ankle crease here. And again, with these releases, and you can find a lot of these on our YouTube page, if you type in React Physical Therapy on YouTube. The main thing with this is these might feel a little uncomfortable, especially if this is a new injury. It might feel a little uncomfortable or intolerable. The main thing is this should not worsen the symptoms that you have. So let's say, for example, you are experiencing some shin splints, and this middle portion of your shin and this muscle is very, very sensitive. What I would recommend is starting above it or below it or to the side of it so that you can slowly ease your way into tolerating this position. And with this, I would say, since we're covering smaller muscle groups in the foot and ankle, I would say anywhere from 30 to 45 seconds for the entire muscle length itself is sufficient. Now you're going to find through trial and error that there might be areas that are a little tighter or a little bit more tense than others, and you can always spend a couple extra seconds in those areas. Again, this isn't meant to last and take a very, very long time. Okay, so again, this muscle is called the tibialis anterior and controls the upward motion of the foot. Okay, another release that I like is the side shin or the peroneal release. So this muscle produces the side-to-side action, the outward motion here. Oftentimes what we see in our assessment with folks that have foot and ankle issues is that they tend to walk on the outside part of their foot. So these muscles here, this muscle here, a lot of the tension and force gets relayed there, meaning that it is doing too much work comparatively to the inner portion of the foot and the inner portion of the calf. So to release that, again, what I'd like to do is use a lacrosse ball, and again, finding a comfortable position. So now, compared to the first one, we're going here, we're going to move to the side. There's a little bone right below the knee joint here that you can find. You're going to go just below that, and you're going to hold it, and then you're going to go side to side with the foot. Now again, I'm flexing my hip so you guys can see. I'm going to lower it down here. But what you guys can do is just hold here, and then just go side to side. Again, as I'm going down, I'm going side to side. And the main thing to watch for this is that I'm not moving my hip side to side. I'm isolating my motion to the foot and ankle itself. So compressing, I'm moving side to side with the foot. Again, I'm not going to spend an exorbitant amount of time here, maybe 30 seconds, 45 seconds once I find those areas that are tight and tender. Okay, so we've covered 2 so far. We're going to cover 2 more. We're going to do the arch of the foot, often where the plantar fascia is overlaying itself, and then we're going to do the calf muscle. Okay. Okay. So the arch of the foot, I'm going to stand up here so you can kind of see. You can do this in a seated position. I will do this in standing so it's easier to see. So you're going to go on the inside part of the foot here, apply a little bit of pressure. You're going to roll back and forth. And again, this may be very, very sensitive, especially if one is experiencing plantar fasciitis. So we're going to roll back and forth, kind of find that tight spot, and then we're going to curl the toes back and forth. Now, some of you may have done something similar with an ice bottle or a cold bottle of water, a frozen bottle of water, if you've experienced plantar fasciitis. What that will do is, that's going to, ice is good because it's going to numb the area. But again, the rolling back and forth, again, there's nothing wrong with that, but a little bit better to enhance that muscle activation is to engage the toe muscle. So we're going to curl back and forth. Again, we're working along from the base or the bottom of the big toe inward toward our heel bone here. Okay, so we're curling back and forth. Again, if the standing position is too much weight to accept, we can do this in a seated position, where you can just kind of roll back and forth and curl the toes for me, especially if this area is tender or tight. Okay? The last one that we're going to do is the calf muscle. So the calf muscle is comprised of the muscles behind here, and that allows us to push off and point the foot down. So what we're going to do is we're going to take this ball here, we're going to place it underneath the inside part of our calf here, and we're going to pump the foot up and down. Okay, we're going to do a few repetitions, maybe 5-6 seconds, and then we're going to slowly roll that ball down the inner aspect of the shin. Okay? This is going to take a little bit more time than the other muscle groups, just in terms of muscle length and density. So I'm going on the inside, and once I get to the bottom, just above kind of the ankle bones here, I'm going to move the ball slightly to the outside to get the outer portion of the calf, because the calf has 2 heads, one on the inside, one on the outside part here. So then we're just going to repeat that process, but now since I'm at the bottom, I'm going to roll my way up. And again, ways to add or modify this. Again, you can, since I'm laying on this, you can add as much pressure or take away as much pressure as you need. So as we're going here, if you felt that this was not enough tension, you can use your other leg to add some downward pressure, which is gonna make it feel more intense, but that might be something that you need if this is, if the self-release or soft tissue stuff is something that you have experience with. Okay. Sorry, folks. Let me see where my screen is. Seem to have lost. Okay. So we did some releases. So now we're going to cover some mobilizations. So mobilizations are effectively just ways to increase the movement at our joints. So our joints can get stiff, and we can get them all through our body, right? Like if you ever felt like you had a crick in your neck, or you feel like there's stiffness in maybe your hands or your back, and you feel like you need to crack it. Sometimes these mobilizations can allow improved movement through the joints, right? So we have our bones, which comprise our joints, and we have our muscles, which effectively help move our joints in fashion. So some mobilizations that we want to focus on with the foot and ankle are different portions, right? So we're going to talk about the ankle joint itself, which is right here. This is our ankle joint. We're going to talk about the midfoot, which again is the middle part of the foot here. We're going to talk about a big toe. I'll take my sock off here in a second so you guys can see. And then the toes itself. So some ankle mobilizations. I'm going to show you a really simple one here. I'm going to get down on one knee. So a really easy one to do. Okay, you're going to come into it like a half kneeling position. We're going to get our foot flat on the ground. Move to the side here so you folks can see. And all you're going to do is you're going to keep your foot flat on the ground. We're going to use some pressure here, and we're just going to drive our knee forward. You might feel a little bit of stretch here back in the Achilles and calf region, but this is going to help increase the angle at which our shin can go over our foot, which will help propel us forward. So an easy one here, again, you're in a half kneeling position here. I would recommend putting a pillow or a cushion if you have hardwood floors or something that's a little bit more firm. And you're just going to drive forward. Now, something that you can do if a specific position is stiff, let's say we're going forward. Now, if that's too uncomfortable in this joint here, what you can do is slightly push your knee cap toward the outer portion of where your little toes are. So we're going to push a little bit outward and angle toward that way. That might help free up where some of that stiffness is. Okay? Another mobilization that we want to work on for the middle part of the foot. So again, here's the front part of the foot where the toes are. The middle part of the foot is just above the arch here. So a nice one that I like for that is there's two ways you can approach this. So we can use our other foot, and all I'm using is the heel to apply a little bit of pressure to the inner part of the foot. Okay? So I'm going to come here, and I'm applying a downward force. Again, I'm just kind of stabilizing, meaning I'm just using this to anchor it down. I'm not jamming down on my foot here. I'm going to anchor down, and then with this, I'm going to twist at the knee, back and forth. Now, if this irritates the knee or the hip itself, again, you can just move front to back here. Okay? Or again, just side to side, just rotating, trying to bring the knee in, bring the knee out while maintaining this anchor down. Okay, the big toe. Now for the big toe, there's a couple different things we can do. Now for this is a good stretch that I like to give for people experiencing plantar fasciitis, which again is at the base of the heel here, very localized inside of the heel. So what I like to do to mobilize the big toe is you're going to apply pressure just underneath the ball of the foot here. So my thumb is on top, kind of where it bends and extends. So I'm anchoring here, And then I'm going to take my other hand and I'm going to distract, which means I'm pulling outward and then bending backwards. So anchor, pull, stretch. So this is one that I like. You should feel a nice stretch in here, but also a little bit pressure here. Now with the mobilizations, they should not be or reproducing pain with this. Like they might be a little uncomfortable at first, just as you're kind of easing your way into this, but they should not be reproducing the level of intense pain that you might be experiencing. Another way that is a good mobilization of the big toe is getting an elevated surface. So I like to use a rolled up towel. What I like to do with that is just kind of stand on it. So like my toes are slightly elevated, and then I'm going to just press with the front part of the toe to try and extend here. Again, you can do this in a seated position as well if a standing position is too uncomfortable for you. Now we're going to go into the toes themselves. Something that I like to do for the toes is just taking your hand, or for those of you that may get pedicures or do yoga, they have those little foam pads called yoga toes. But if you don't have any of that, and again, no equipment is necessary, just kind of interlocking your fingers in between your toes and then just moving it back and forth. This is going to create a little bit of space or gapping in between the toes, especially if you're, wearing high heels or flats or just dress shoes that are going to compress the front part of the foot. It can be very, very stiff and achy. So just even spreading or moving the toes out back and forth is going to be good. Okay. In our next sequence, so we've done the releases with the lacrosse ball. We've done the mobilizations with the joints using our hands or other body parts to help stabilize the joints themselves. So now we're going to go into activation. And what we mean by activation, and something that we use a lot in the clinic, is meaning waking those muscles up. So a lot of times if a muscle is stiff or tight or maybe not producing the force that we would like it to do to give you your body the support that you would need, we like to do an activation technique. And usually what that means is that we're going to do a movement-based exercise that is going to elongate or lengthen the muscle to help stimulate the firing potential of that muscle. So there's a couple good ones that I like for the foot and ankle. So the first one is called the nose to wall exercise. And for those of you that have been patients of ours, I'm sure you've done a lot of these with some stability at a pillar. But I'll show you this. And again, this requires no equipment. It's going to be in a standing position. But if you do need support, using a chair, a couch, getting close to the wall is going to be your best friend with this. Other forms of this, some folks call it in the fitness world or the health world, the woodpecker. Awesome, just based on the way that your body is going to be moving. I'm going to demonstrate this here. So I'm going to come back. Apologize for see the lower portion. Okay, so we're going to go here. So this is my left leg. We're going to turn. So my back foot is like an anchor. And what this means is this has about 10% of my weight, or about 5% of my weight through it. So the main point with this is we're going to activate the Achilles and the calf muscle back here. So again, I'm going to show you here. So I'm going to use this chair for a little bit of support. Again, I'm just using kind of like my fingertips to support it. I'm not gripping on here. So most of the work should be done by this foot. So foot's flat, back foot anchor, a little bit of support here if I need it, but I'm not going to do it. So I'm standing nice and tall. The weight is through the heel of my foot. What I'm going to do is shift the weight from my heel to the ball of my foot and backwards, but I'm not using this foot to push myself forward, okay? So again, this is kind of like a little bit of an anchor. I'm leaning forward and then coming backward. Leaning forward, now the weight's on the ball of my foot, backward. Forward, backward. You should feel a nice stretch in the back part there. This is a good activation technique that I like before activity, especially runners and endurance athletes. But again, if you're going to be on your feet all day, this is a great activation for that. And with this, I would say a set of 10 or 15 on each foot is a great way to start with this. This doesn't have to be overcomplicated. The next activation is called a short foot arch, meaning that we're going to engage the muscles that kind of help control the foot. So what this is going to look like is we're going to be bringing the base of the foot here back to our heel. So we're going to be lifting, kind of shortening the muscles here. Now, it may feel like you want to like curl your toes down, but we're going to try and keep the toes, the second, third, fourth, and fifth toe relaxed while that big toe is kind of anchored a little bit more. And as we kind of pull back, the foot should the middle part of that foot should raise up a little bit. And you should feel these muscles on the inside part of the arch start to fatigue. And again, 10 to 15 of these on each side is a great way to kind of activate the foot muscles, the ones that give us all the stability there. And then another activation technique / exercise that I like to do to get the toes going. So we did, the back part of the calf here, we did the arch of the foot. Now we're going to get the toes themselves. We're going to kind of spread and splay our toes out, bring them down, curl them up. Bring them down, curl them up. Bring them down, curl them up. You can do both feet at once. You can do one and switch. So now we're just engaging all the little muscles on the underneath part of the feet that help grip and curl the toes. Okay, we're going to move into our next sequence, which is the strengthening sequence. So I know I'm running a little bit behind time here, but I wanted to make sure that I cover everything. So there's 4 things that we're going to cover. The first one is the ankle strengthening series. So with this, we're going to use a resistance band. So we're going to 4 different directions. So the first one we're going to do, and I'm just raising my foot here, you could be seated, right? So we're going to put it right at the base of the foot. And then we're going to be pushing downward. So this is going to work the calf muscle. Okay. Now to do the inward motion of the foot, what I would recommend is either using your other foot to stabilize outward, so you can, I'm going to cross my legs here, and now we're pulling inward. I'm just using the muscle here, so my foot is going inward across. I'm not using my hip or knee to move it. Okay, so we're going inward to go outward, and we're going to pull the tension the other way. So now my foot is going to rotate out, and this is going to get those outside muscles, which was one of the releases that we had talked about earlier. So we're going to go outward. Okay. And then the last sequence is going to be upward to work that shin muscle. So with this, I like to step on it, and all you're doing is the front part of the foot raise. You should feel the shin muscle working. Okay. So with any of these strengthening exercises, with the level of resistance, I would say 20 to 25 of each of the 4 directions on each side. Now, if you only are affected on one side, I would say you would want to do an extra 5 or 10 on that side. So let's say you had a left ankle injury. What I typically would prescribe is 25 times on the left ankle of all the 4 directions and 15 times on the right side. Another good exercise that we want to strengthen the calf muscle itself are heel raises. So the main components with that is that we're just doing, so we're here, we're gonna do, again, my back foot's here just for support. We're gonna go up to the balls of your foot, kind of working the calf. So my knee is straight right now, or locked out. So from the front view, it's straightened. Side view, okay? What we can also do is a bent knee raise. So this is gonna work a different portion, or the underneath aspect of the calf, which is called the soleus muscle. Okay, so if you're unable or your balance is off, doing a double leg heel raise or both at the same time is just fine. Another one that I like is single leg balance. So with that, again, we're just gonna use some support if we need to. Just trying to balance by yourself. Again, if you need support to start, that's fine. What I would suggest is remove one hand, then remove two hands as you progress. Now with this, with the balance, you can do for time. So 20 seconds, 30 seconds, and work your way up. Okay, so I'm gonna share my screen again with you guys. So managing symptoms, a little bit about pain. Pain is not always a bad thing. Pain is there to help you recognize that there may be something going on that you might want to approach. Maybe you've walked too much. You got back to your favorite activity a little bit too soon after taking a break. You want to monitor your 24-hour pain pattern. What do things feel like after the activity? You know, if you just went to the gym, you might feel some soreness in the next day or two, but do things kind of resolve or go back to your baseline level? You may need to modify before you eliminate. So let's say you are lifting weights or doing a resistance training program. Maybe the weight that you're using is too intense, so you might have to modify that by decreasing the weight or the resistance. Maybe the tempo, meaning how quickly you're going through your motion, you need to slow it down a little bit. And also the frequency. How often or how many times a week are you working out and training these body parts? Maybe you just need to take a little bit more break in between them. When you're managing pain symptoms, you want to stay as active as possible within your pain levels that you feel comfortable with doing. And then I like to inform my patients and use the stoplight analogy. And what that effectively is a way to kind of help monitor how your pain is treating you. Now, this is going to be unique to your pain level experience, okay? So we're going to use a 0 to 10 scale. The green light, or kind of no modification necessary, is 0 to 3, meaning kind of go at it. You don't have to really kind of modify or take any breaks. Our yellow light, where we want to use some cautions and modifications, if you're experiencing symptoms that are in that 4 to 6 range out of 10. Now, if things are quickly dissipating, or you stop an activity and your baseline goes back to 0, it just might be that your body's not able to withstand or engage in that activity for the duration, frequency, the tempo, all those kind of things I talked about. You may just have to ease your way into that. And then our red light is our kind of stop that exercise or movement. Something's going on that your body clearly does not like, and we want to make sure that we're avoiding any serious injury at all costs. And if you need to return to activity, this is what I inform my patients and give education on, is you want to start slow, especially if you've taken, a chunk of time off, 3 weeks, 4 weeks, a month, a couple months. You want to start slow and acclimating back into that, okay? And I would recommend cutting your pre-injury routine by 50%. So if you walk and you used to walk for 3 miles, I would say see how 1.5 miles goes first. See how your body responds to resuming that activity before kind of ramping back up to where you previously were. Being consistent. You want to do some moderate exercise about 3 to 4 times a week. But again, that's going to be dependent on what your previous or current activity status is. If you are somebody that has always been active, then this might not be difficult for you. But if you're somebody that's a little bit more sedentary, maybe spends a lot of time sitting down or is not very active, then slowly incorporating this into your day-to-day lifestyle will be super beneficial, but taking it slow is going to be important. And also being patient. It takes a lot longer to build up that stamina and endurance than it does to kind of lose it, unfortunately. There's no way to kind of speed up that process.
And then how can a physical therapist help? What can we at React do for our patients? We take a subjective history of your pain and symptoms. We take objective data to assess your mobility, your range of motion, and strength, and formulate a plan on day one so that we know as we go through our treatment plan how to kind of approach that, so we have our benchmarkers to kind of go forward from that. We want to identify triggers to reduce your pain. What are some things that typically aggravate your symptoms? How can we modify your activity or your exercise so that you can still stay active while also reducing the frequency or intensity of your pain? We want to build resiliency. We want to give you the tools to help self-manage your pain and symptoms. We want to take a whole body approach to treatment. We want to make sure that we're identifying root causes and not just applying pressure or addressing one simple thing, because oftentimes our site of pain isn't always the same source of pain. So we want to make sure that we're taking a whole body approach to your area of treatment so that we can give you the best advice and help be your guidance tool to go forward. In summary, foot and ankle injuries are very, very common and something that we see on a daily basis. Activity modification can help you and stay active. You want to be patient and consistent. And then seek help. That's what we're here for at React Physical Therapy. All of our locations offer free complimentary 15-minute pain assessment and consultations. If you're not sure if starting the physical therapy treatment route is right for you, give us a call, email us. We'd be happy to set you up with one of our therapists. We have 3 city locations, one in the West Loop, one in Lincoln Park, and one in Lakeshore East, which is located basically behind the Aon and Prudential building off of Michigan and Randolph. And then we also have our northern suburb clinics in Wilmette and Deerfield. Again, my name is Franco. I'm here located at the West Loop Clinic. Our phone number is 312-243-9350. Here's my email address if you had any questions directly. But if you want or need any more information about React itself, feel free to look at our website, www.bereact.com. I'm going to unshare the stop part. We have another question from, do these exercises help with neuropathy? Yes, some of these can definitely help with neuropathy. So neuropathy is a numbness and tingling which can affect our extremities, meaning our hands or our feet. And sometimes this numbness or tingling can affect how we feel our body in space, also known as proprioception. So sometimes we don't know where we're placing our foot, so that can definitely throw off our balance. These can definitely be one step into helping regain your balance, but we would also kind of take a look at your knee strength, your hip strength, your pelvis, and your trunk, kind of looking up the chain as well. But these are definitely some starting points that you can absolutely help to kind of help treat your neuropathy. If none of you have any questions for now, I'll give you another thank you. I appreciate it. We will definitely have this webinar for you on our website. If you go onto our website again, which is www.bereact.com, there is a toggle menu that will have this webinar as well as previous webinars that my colleagues have performed. I want to thank you all for joining, and I hope you guys have. Thank you.